For the past 2 hours, you have listened to educators, administrators, students, parents, survivors, and community members share the importance of understanding how suicide prevention fits with your role as an educator, recognizing and identifying students who may be at risk for suicide, understanding the protective factors that prevent suicides from occurring, and responding and referring students who may be at risk for suicide and self-injury. In order to refer young people who may be at risk for suicide and self-injury, you need to be aware of what resources exist in your school, in your community, and statewide. In Massachusetts, there are several 24/7 crisis service hotlines available that provide support and services for young people that are struggling with suicidality. Additional resources for young people struggling with suicidality are included in the appendix section of this training. As mentioned throughout the S word, suicide prevention is everyone's business. To prevent youth suicide, it is important to partner with local suicide prevention organizations like the Massachusetts Coalition for Suicide Prevention.
The Massachusetts Coalition for Suicide Prevention, or MCSP, is a partnership of state agencies, community organizations, mental health providers and consumers, survivors of suicide loss and suicide attempt survivors, community and regional coalitions, and other stakeholders with a shared interest in the coalition's mission of preventing suicide through statewide collaboration and advocacy. Through our 5 priority areas of memberships, advocacy, structural development, strategic plan evaluation, and regional coalition support and development, we promote partnerships between organizations, document the impact of state-funded suicide prevention work across the Commonwealth, serve as a network for sharing resources and information, provide leadership and advocacy, and help to support and strengthen the work of the 9 regional suicide prevention coalitions across the state.
We work with many schools through our SOS Signs of Suicide Prevention program. And when we're asked to come into a community and provide resources and support, one of the first things we do is reach out to both the statewide and our regional coalitions. No individual school or community should feel like they have to increase awareness and take on suicide prevention alone. And I think it's been so valuable for my organization to really be able to connect with resources, coalition members, and experts in our state to make sure that we're effectively providing the best prevention efforts that we can. And I know particularly I've worked with both of these coalitions in delivering a suicide prevention program in their regions, and it's gone over very well, and the schools really appreciate knowing that there's multiple resources in the community that are there to help them.
We've done a lot of different services for the 51 towns that we cover. We have leadership breakfasts every year, and we honor both an adult and a youth who has done some work in the suicide prevention area. We have done multiple trainings. We took a Connect training, which is from the National Alliance of Mental Illness in New Hampshire, and have done over 2,000 people that we've trained. And we've also, in that 2,000, include 12 schools that we've trained as well.
Last year, our regional coalition produced and developed a documentary on suicide attempt survivors. It was called A Voice at the Table. That's been recognized by the American Association of Suicidology, the National Action Alliance now. Even Suicide Australia has it on their website now. We're working on now another version of workbooks, as is Deb's Coalition, for suicide attempt survivors, and we have a teen version curriculum that we've pulled together and presented. We use Safe Talk a lot, Assist, and finally had an opportunity to go into Taunton High School and do a Safe Talk for students. So we're moving forward with a lot of what we do.
Another value to the coalitions, both the state level and the region, it's cross-disciplinary. You know, it's not just mental health professionals.
Yeah.
It's different voices at the table, just like Anne Marie said. Yeah. And, you know, I think that's been really crucial to making sure that there's an effective approach, collaborative approach to awareness and prevention.
As you have just heard, MCSP regional coalitions are involved in a myriad of activities across the state. If you would like to learn more information about MCSP, please accept this message as an invitation to attend a general membership meeting, our kickoff breakfast, State House Awards event, or the annual Department of Public Health conference. Feel free to contact us through our website, www.masspreventsuicide.org, or through our email, info@masspreventsuicide.org. We thank you for the work you do every day and look forward to working with you. We trust that together we can build a competent care community that is committed to prevent suicide through statewide advocacy and collaboration.